where we are seeing digital technology is not just supporting healthcare, but also I think it is able to be about AI-driven diagnostics. We've also been able to see remote patient monitoring that is happening. We've also heard about telemedicine to data-powered public health strategies, and we are also witnessing a paradigm shift in how we care. And how care is delivered and accessed, and also experience, customer experience is at the core nowadays in the health sector. So this transformation does not happen in isolation. It requires collaboration, and that's why the whole game is one. Bold thinking by all of us, but also so this morning, that's why we are gathered here for this symposium. We are able to bring the brightest minds in the room and be able to passionately bring our hearts together and imagine and co-create a future where digital health solutions will truly serve everyone. Inclusivity is key to that to everyone, everywhere, regardless of where people are located, regardless of their background or even their geography. So as a chairperson of the board of monitoring, I'm really immensely proud of the work that our organization has done using technology to connect health services, the last mile person in the different communities where we are. And I'm equally excited to see that this conversation. So, in the next 2 days that we are here,
if you can give me one from the other alphabet,
but also in the different conversations, different collaborations, and
no, we're only guy.
opportunities, not only showcase what we've done, our experiences, but also let us showcase what is possible and also challenge ourselves to think bigger and move faster because the movement is moving faster and also build the systems that are more inclusive, also resilient, and also sustainable. So thank you so much once again. Thank you for coming.
Morning, ladies and gentlemen. I am actually standing in for the Chancellor of Clark International University, Professor Moses Galkande, who on his way here was called back to do an emergency surgery, so he's not able to be here with us today. I had my own remarks as part of the convening of this event, so I want to go through those very quickly before I read the keynote that was handed to me for Professor Galkande. The board members of Mobile Clinic, the management of Clark International University, distinguished ladies and gentlemen, thank you so much for agreeing to be here to spend your time with us over the next 2 days. We have been intentional in inviting thought leaders in this space, in the room. It was designed that way. When you convene a thought leadership dialogue, there has to be an identified gap or a need to hear about what people are doing in their respective organizations to advance a specific agenda. For us, digital health is important. Clark International University's mission is to develop students for global leadership and for those students to be catalysts for transformation. Part of what is enabling transformation in our clinics, in our hospitals, and in our community are new technologies and digital skills previously not part of our curriculum have taken center stage. So when I graduate nearly 500 students every year at Clark International University, I sit back and I wonder, how ready are they to encounter a world that is increasingly digital? Whether it is a midwife, whether it is a nurse, a clinical officer, a pharmacy officer, a laboratory technician, a public health officer, and we do have some of our alumni in the room who are doing some of that work. How ready are they? Part of our curriculum for many years was quite dated, didn't even reflect a single RCT course for the nurse or the midwife. But when I release them, they come to work for you in your communities, and the first thing for you to assess is how confident they are with their digital skills. I wanted to highlight a little bit of what is the ongoing gap, particularly for our context in terms of digital health. But let me start with how important today is. I don't know if many of you remember that today is the Global Accessibility Awareness Day. When we designed the program and chose this day, we weren't even aware of its importance. But today, many organizations around the world are celebrating and are convening to further the dialogue on global accessibility when it comes to digital tools, particularly for persons with disabilities. And I realized, Mr. Andrew, that was a major omission for our agenda today. We ought to be thinking about that inclusion. You know, how digitally competent are our organizations in catering for persons with disability. So really important. But other ongoing challenges, the digital divide in Uganda is further exacerbated by internet access and usage. As of 2024, I believe only 50% of our population had internet access. I know you see a lot of people in Kampala on their cell phones, and I think it's a bit deceiving. You know, because everybody in this room probably does have access to some internet. But actually, when you look at the national data, only 50% of the population have access to adequate internet. Only about 9% of the residents in the communities, which is part of our agenda, have access to internet access. This highlights a pronounced gap and divide between the rural and urban centers. So if we are developing community programs, that's the gap. And that's why you are here as a thought leader. So how do we continue
ogezaako konkolinga kino
digital
n'oteekamu
tools
obuteese
and solutions that can close that gap. The other gap is infrastructure and affordability, especially in the rural areas. Challenges include inadequate electricity supply, the high cost of ICT equipment, and so on and so forth. So the question is, for you as an innovator, as a thought leader, as an investor, what is it that we can do now with the limited access? And that's really where the innovation comes in. And because we can hope for better internet access in the next 10 years, maybe Musk will come and negotiate with our government and improve our access. But the question is, as the tenants of this leadership time, what is it that we are able to achieve with what we have? And what kind of innovations exist? So we look forward to hearing what you have to present so that we can all borrow some ideas to advance our work in the communities. The other gap is digital literacy skills. I hope that in some of our conversations today, you can address that. And I really want to challenge thought leaders from the education sector and from the hospitals. What are we doing to increase literacy, digital literacy, for professionals that are already out of the university? Universities can work to revamp and revolutionize the curriculum as long as the regulatory frameworks are allowing us to do so. But we do have professionals that are already out there, and they are responsible for the majority of the work that we need to do. So what programs are we developing to bridge that divide? And then my favorite topic, gender disparities. Okay? The digital divide is also reflected in these disparities. Women are less likely than men to own a mobile phone or access the internet. When I read this, I was a bit like, what? All the women I know, you know. But these are what the data are telling us. More importantly, cultural norms, limited digital literacy, affordability issues contribute to this gap for women. So we need to be thinking about gender inclusive digital access in all the programs that we are mounting in our organizations. And then we have the issue of the impact on the economic sector. And in this area, we really can make a good case for additional increasing investment from the government and from other funding agencies. We need to amplify access. How do we do so? We know that being digitally competent is going to improve, every sector, including our finance and economic sectors. So, is it possible to make a case? This disparity limits productivity, economic growth, especially in less digitized sectors. And the health sector, unfortunately, is one of those sectors. Somewhat, we are not able to create solutions quickly. And we know that we can't afford to increase access for many of our populations in this country. There is a doctor here who is really passionate about creating digital solutions. David Mugandu will be speaking to us later on today, so I'm really excited to hear what ideas are emerging in that space. Of course, agriculture sectors are lagging behind. Other informal sectors like retail, on the streets are all lagging behind. But the center stage for our conversation today is health sector, and I would like to hear what is emerging in that space. And then finally, my question to you all is, how do we bridge the gap? How do we bridge the gap? What exists that we can leverage? What are some of the emerging ideas? What are some of the emerging evidence-based interventions that are being rolled out? We would like to co-explore those in our conversations today. So I hope that we have good deliberations in the next 2 days. I am here to listen. I am excited to listen because I learn better. I am inspired when I have space to think and listen. And as the Vice Chancellor, I don't have that much time to do that. So the next 2 days are protected. I am going to plant myself here and simply listen. Now, ladies and gentlemen, I would like to read the keynote for this morning from Professor Galkande. Distinguished guests, esteemed speakers, panelists, delegates, ladies and gentlemen. It is both an honor and a profound privilege to address you at this inaugural Vitendo Digital Health Symposium, VIDIHSA. I extend my deepest appreciation to Mobile Clinic, Clark International University, and all our distinguished partners for the visionary leadership and commitment to demonstrate in convening this important gathering. Your efforts are timely, strategic, and catalytic. Today, we converge under the theme From Dreams to Action, Shaping Africa's Digital Health Future to Strengthen Health Systems. To deliberate on such a subject of strategic significance, not just for Uganda, but for the entire African continent. Indeed, this symposium is a clarion call to transition from conceptual dialogue to actionable, scalable conditions for digital health integration. Africa's health systems have, historically, faced considerable systemic challenges: inadequate infrastructure, fragmented service delivery, low health work density, insufficient access to essential medicines, and pervasive inequities in health outcomes. These challenges have been further exacerbated by emerging public health threats, climate changes, and rapidly evolving demographic shifts. Yet, within these challenges lies a profound opportunity. The fourth industrial revolution, characterized by artificial intelligence, robotics, big data analytics, blockchain, and the Internet of Medical Things, is offering Africa an unprecedented chance to leapfrog traditional barriers to healthcare delivery. M-Health Solutions, across our continent, we are witnessing the rise of telemedicine platforms, mobile health solutions, centralized electronic health records, predictive analytics for disease surveillance, and robot-assisted diagnostics and interventions. In Uganda, we have recognized the transformative power of digital health in achieving universal health coverage and resilient health systems. We have therefore integrated digital health priorities into our national planning frameworks, including the National Development Plan 3, which emphasizes innovation and ICT as enablers of socio-economic transformation. The National Information and Digital Health Strategic Plan 2020-2025 aimed at strengthening health information systems and promoting interoperability. Uganda's Digital Vision 2040, which envisions a fully digitalized society across sectors, including health, has also been established. Through these frameworks, government is facilitating a multi-sectoral approach to strengthening and privacy, and foster an ecosystem that nurtures innovation and sustainable investment in digital health. It is important to underscore that digital health is not merely the deployment of new technologies. It is about systemic integration, aligning digital solutions with national health priorities, ensuring equity in access, building the digital literacy of healthcare workers and citizens alike, and safeguarding ethical standards in data government and use. Further, the success of digital health transformation will depend on 5 critical pillars. 1, leadership and political commitment. High-level governance structures must steer digital health agendas, ensuring policy coherence and sustained investment. 2, robust digital infrastructure. Affordable, accessible, and resilient ICT infrastructure is non-negotiable. 3, capacity building. Human resource for health must be retooled for the digital era through skilling, upskilling, and reskilling initiatives. Number 4, community engagement. Digital health solutions must be people-centered, culturally sensitive, and tailored to the realities of a diverse African community. And 5, research, innovation, and evidence generation. Investments must be underpinned by data-driven insights and adaptive learning frameworks. As we gather here for the next 2 days, I encourage all participants, policymakers, innovators, researchers, health practitioners, technologists, private sector players, and development partners to approach discussions with a spirit of collaboration, foresight, and urgency. Through preliminary sessions, technical panels, parallel workshops, and knowledge exhibitions, we must interrogate critical questions such as: how do we ensure interoperability across diverse digital health platforms? How do we sustainably finance digital health innovations beyond pilot phases? How do we safeguard ethical AI and protect patient data while maximizing innovation? How do we empower the last mile, the rural, the marginalized, and the digitally disenfranchised? In conclusion, the future of healthcare in Africa is linked to the digital transformational journey we chart today. Africa cannot afford to be a passive consumer of imported technologies. We must be producers, innovators, and shapers of our own digital health future. As leaders, we must create enabling environments. As innovators, we must remain agile and responsive. As academics and researchers, we must generate evidence that informs scalable models. As communities, we must embrace digital literacy and digital citizenship. I'm confident that through the collective intelligence represented in this room, VIDIHSA will not only generate bold ideas, but also concentrate on actionable pathways for transforming Africa's health systems through digital innovation. Together, let us move beyond dreams to decisive action. Together, let us shape a healthier digital Africa. I thank you for God and my country.
Thank you very much, Associate Professor. That was indeed not only educative, but quite informative and elaborate. Another round of applause for her. Thank you very much, Professor. We are going to have a team from Bobby Clinic come in front and take us through their new products called Clinic. We're going to launch it. As a way for them to come, we're going to split ourselves into two groups. Group A, we organize as various speakers. We have Team A and Team B this side. As the day goes by, we're going to be having small competition between the two teams. At the end of the day, we want to see which team will be victorious. I love the way we distributed ourselves. We have right here, board chair, obviously, seated with the associate professor, the DC. So we're not going to say that we have rigged the election for Billy or for Black. And the first question I'm going to ask us, a small game as the obviously team comes front. It's called two truths and a lie. So I'll give you three statements. And then the first person to put up their hand from either of the two teams. Just identify
Screen
for us
it
which
there,
of the three statements is a lie. Okay, ready? Don't worry. Professor said there are no students here, so there should not be any shame in giving the answer which is not the one that I want. So the first statement, WHO has a global strategy specifically on digital health. Second statement is VIDIHSA, Vitendo. Vitendo is the Latin word which means action. Third statement, women are less likely to have access to a smartphone and internet. Very first, which of those three statements is a lie? This was the first one to go out.
Thank you very much. So, as a citizen of a Swahili speaking country, I can assure you that Vitendo is not an acting word. It's a Swahili word. But it is action. So, that's where your lie is.
Yes, thank you very much. Indeed, that's a lie. I tried to twist it a little bit. I know people are used to words originating from Latin. They tell you capital is a word that comes from the Latin word this. This comes from the Latin word this. So I thought all of us would fall for my trap. Thank you for not falling for my trap. Okay, is the mobile clinic team ready? Are we ready? As they walk up, I would like to just briefly recognize a few important dignitaries that we have in our midst. Associate Professor Dr. Rose Black Nanyoga, she's just given the keynote address. We have Madam Bright Simwe, board chair of the clinic. The two powerful ladies are seated next to each other. We have Dr. Singh Milka, the Deputy Vice Chancellor, Black International University. Thank you for coming. We have Dr. Crispin Leda, the board member of the clinic. Thank you for coming, Doctor. We have Mr. Keegan Scotland, is the CEO, RSMM Medical Supplies of Africa. Thank you for coming. We have Dr. Shannon Kakungulu, the Executive Director, Tinda Hospital. Thank you for coming, Doctor. We have Mr. John Bosco Alege, the Dean, School of Public Health, Clark International University. Thank you for coming. We have Mr. Isabelle Nicholas, Business Development Manager, Clark International University. Thank you for coming. We have Mr. Robert Lubanga, ICT Manager at Clark International University. Thank you for coming. We have Ms. Rita Namuteri, the Dean of Students. Black International University. Thank you for coming. We have Mr. Robin Chibuka, board member, Mobile Clinic. Thank you for coming. Thank you. I'll now hand over to the Mobile Clinic team.
Everyone, we are so delighted everyone is here. Thank you for coming here. We are so proud to have people come here to join us as we celebrate our milestones as Mobile Clinic. My name is Magen Arafat. I am the Chief Technology Officer at Mobile Clinic. I am the team lead for the African products. What you see here is a clinic platform that Mobile Clinic involved. What you see here as your clinic is we had an idea one day. Our CEO was about to join us. Went to one of the facilities for an appointment around 9 a.m. and he left about 2 p.m. So it's like if I can have something where I can interface with a doctor or a service provider at my comfort, that would be great. I mean, we are quite busy and too much traffic. So then, how about we let's do something that can interface a doctor or a facility where I am for consultation, and then when there's need be, then we can always go to the hospital. We're not saying we're trying to divert our people from going to hospitals. No, they are trying to feed it into their way of life. They are busy, we understand. So we are saying, let's feed it to their own life. If you can't go to the hospital, we have your kids for you to choose your favorite service provider, and then you can interface them and pay a simple amount of money for it. So the clinic has been for over a month. We went for testing, we went for facilities, also our patients, and then we said this is something that's going to change the digital space in Uganda, and we are here to be the leaders in medicine. This is not for us. Thank you so much. So my team here, our team is big, but some of them out here. We all build this thing from off ground, from consultations, change this, change that. And my team has been really dynamic and we keep on changing, iterating, and doing. Up to now, we are still changing this because software doesn't really stop at all. It keeps on evolving as you know, changes evolving every day. So I want to call my dear manager for two products to introduce what is your team. Thank you.
My role primarily so what is that basically help patients, help specialists and providers. So we have on board different facilities around, and we make sure that we vet the people who appear on our website and assure that people are going to get quality services in the different health professionals who are existing. So people can be able to receive health services at the campus level. They can have video calls, they can have voiceover. So we are always using some development called agile, where we are always iterating according to the user needs. Different facilities come with different needs and they tell us what happens here, what happens here. So we are always making sure our product is visible to people because this product, we're not reinventing the wheel. These products have been there, but what our niche is, we are always continuously developing, and we want to make sure that we are making sure our vision at Mobile Clinic is far from getting people. We are making sure that everyone has full access, and all our products are tailored to that vision. So your clinic is a product that has been running. We are usually launching it for either you or the patient. Right now, our task is to make sure that we vet all the health providers on our platform, that pharmacies, and we're also going to add laboratories. So we are making sure that someone is in the comfort of their home. You just have to book an appointment, and you're able to get services. Our payment system is very transparent. You get your receipt. You can even reimburse the case you don't satisfied. So we're making sure that people are always getting convenience, and we're also supporting home care-based services where people need home care. They can always look at. So we are making sure that our users are getting the best health services, because healthcare is one of the basic needs, yet it's something that not everyone has to be able to get. Thank you.
But of course, we need to have products of our software range. We have a doctor who has guided us. Hopefully, he can tell us why this is a valid product for our country.
Thank you very much, Arafat. I hope people do not get tired of seeing me here, because it looks like I'm going to be part of every activity. My name is Dr. Kenneth Muganga. Right now, I'm standing in the capacity of the Chief Medical Officer at Vitendo. And first thing I'll say is, right now, if one of us, God forbid, if we just started nose bleeding, what would we do? Would you turn to your neighbor and ask them for help? Would you leave the session and go all the way to the hospital? Perhaps you don't know the nearest facility around. It might be new in Kampala, or it might be new in the country. Still stranded. You don't know what to do. And perhaps people next to you might not have the best guidance. This one tells you this and tells you that. But lucky for you, there is your clinic. You just pull out your smartphone, and then you go to www.yourclinic.com, and they're going to ask you what you want. Do you want to speak to a doctor? Do you want to book a consultation? Do you have a medical concern that you want to be sorted right away? You say, yes, I'm in a symposium, I cannot leave, but I'm nose bleeding. I need help. And then very fast, they'll direct you to the most available doctor at that time. The doctor will listen to you. They'll give you advice, perhaps they'll give you first aid. And you'll be able to go through your symposium. Later on in the day, you can go to hospital. This is one of the reasons why we thought about your clinic. The world these days is so dynamic. The world these days, everyone is busy. I know healthcare is a priority, but we sit in hospitals waiting for clients. And when the clients come, they tell us, I don't have time. I have a meeting in the next 30 minutes. And you work on me very fast and I leave. And then previously it used to sort of offend us, but these days we got used to have people like Andrew who will call you because he knows Dr. Ken is a good friend of mine. So he'll call you, hey, look, my daughter has this issue, and then they're going to take a lot of your time, and unfortunately they won't even pay you a penny for that. They'll just recognizing you as a family doctor. Family doctor. It's our family doctor for the last 20 years. But the family doctor has never been paid for his services. If Andrew used your clinic, then Dr. Ken would get something small for his services, because Andrew would be asked to pay consultation. And then we have other people like perhaps my father. He's a very busy manager of a business, but he's also hypertensive. And he's supposed to check in with the doctor every month to pick medication. But the gentleman is simply too busy. He comes in after 3 months. Why? Because now he's experiencing terrible headache that's unbearable. And the doctor tells him, can you spare just 20 minutes every month to pass by the clinic and pick your medication? And he'll say, no, I'm so busy. Or sometimes I forget. With your clinic, he can just order, and the medicine is delivered to him. And when he wants to check in with the doctor, he can do so via the video chat. Now, your clinic comes to solve problems of 3 categories. The patients. What do the patients complain about? Long queues in hospital. They are too busy to go to hospital. Or sometimes they feel like their problem is too small. You know, these days, again, I don't know if it's a Gen Z thing or it's just a changing trend. some of our patients actually understand medicine better than us. So they come to hospital and tell us, for me, I don't need to go to the lab because all I have is flu. So as the doctor, you oblige, okay, let me just prescribe something for you. So such people who feel like they might not have enough time to go to the hospital, or they feel like when they go to hospital, they're going to be told to go through a very rigorous procedure, or they're not sure about the queues in hospitals. This comes in handy for them. And then the second category of people whose problems are solved by your clinic are we, the healthcare service providers. Because sometimes we have specialists, and let's say the physician comes in on Monday. This Monday he comes, he has only 2 patients. The following Monday he doesn't come, he's disappointed. Unfortunately, when he doesn't come, there are 8 patients. So the system is sort of unbalanced. The physician is around, patients don't come. When he's not around, patients are there. Or sometimes there is a service that's needed and the service provider is not there. So it also helps facilities to streamline. When clients book via this platform, the facility will know that, oh, our physician is coming on Monday. By Saturday, we can alert them. We already have 10 patients. So the physician who would have come in at 4 p.m. can come in earlier because he already has people waiting. And then again, the health facility, patient records and patient data. It's easier to track our patients because everything is electronic. These days, most of us are moving away from writing. Back then, we used to have files. The patient has a file. And when you come in, we spend 40 minutes looking for your file. And maybe the last time when they were arranging this, that room where the files are kept, your file was displayed. And then we tell you, oh, maybe we need to open up a new file for you. All that has been eliminated with your clinic. I don't know if there is anything that I've not addressed, but I believe for the healthcare providers and for the clients, this is a product that we shall enjoy and we shall love.
Thank you so much, Doctor. So that means from henceforth, there's not having a free family doctor.
A family doctor is already registered in your clinic. My consultation on the platform is 20,000 shillings. Now I should tell you that's a discount because if you came to the hospital, the consultation is 70,000. But if you go into the platform, just 20,000 shillings, we can have our video consultation.
That's convenience and that's affordable. Thank you so much. But again, what is launching a product? And firstly, everything is like a moving train. Software, agency, what does the money go?
Good morning, everyone. Martin was my name, and I'm the Chief Finance Officer at Mobile Clinic. So it's a young, dynamic, flexible, being guided by our core boards. And so we're excited to launch this product. And so the parts of the facilities and the doctors. So when the payments are made, so we usually refund to the facilities their parts or their share, and then we will engagement with the VIDIHSA, and it's a guarantee at the end of every week, so that the embarrassment is always done. So it is a product that is trustable, and so for the doctors and the facilities that could be here, you could give us a chance in the case you haven't onboarded with us. But I can't any further. This being a launch when I am not having my say on media. So at this juncture, I would like to invite Andrew David, our leader, and our team lead. So we are excited to have him as our team lead. It's so funny how he is into law and then he's into health. like he's so versatile, and so we are actually. I would like to make to like just make this comment. I think the biggest lesson I've learned with working with him is a continuous learner. Every time he can call you at any time and say, I checked out this, I checked out this. So he's continuously researching. So we're excited to have you, Andrew. Thank you. I think you should retire from me. But we are so excited to have you here and Vitendo Symposium Africa. And we also hold it prudent to use this platform to share with you what we have also at the moment. We are very cognizant of the dynamics of the healthcare industry. In healthcare, you can never remove the person. Mind you, you're thinking about technology has to work they have shared here what you're doing that simply marketplace for all the people. You can provide you can have the facilities, you can have the video doctors, all in one place. We also have two location abilities, we have the Chile, we have the Chile hospital. With that group that is going to go. If you're in a power, we'll give you your range and like that. What we are trying to do is for people to leverage technology for workplace. Today, while people are using Uber for healthcare, for transport, they're using Glovo for food, and we know that we need this marketplace. And because of the dynamics of the industry, we also incorporate a big where someone needs to book in for physical consultation. We know that sometimes it's not going to be just online, but still hospitals can use our platform to manage their physical calendar. And but also the platform someone can offer mobile service providers. We also have mobile service providers. So we have a facility that also offers mobile home care. This is the platform. And then we are happy that the hospitals that are on board here also offer home-based care. So we offer the technology, and then the providers offer the service. So that's why we have to be happy. And this room we have now prospect partners, and we are happy to share with you this product. And also the other is that we are open to customizing for certain hospitals, for some big brands that would like their customized stuff. We offer software as a service also. The sim is very highly creative, and you can trust us that as we come to talk at Vitendo, we go beyond the rhetoric and we talk, but we match it in action. And that's why we want all of us to be part of it. And since the healthcare, the digital health ecosystem is still a growing industry in Africa, let us move the marathon together. Because digital health is a marathon, it's not a sprint. But in the near future, we believe that those who partner with us right now will have very well. So I invite you all to the clients, to your clinic, but also to the partners, for those who are facilities and for the many doctors who are in the room. So this is your clinic, ladies and gentlemen, and I'd like to invite our co-chairperson, Peter, as simple as that. Yes, being guided that in the audience, some people have questions, and we can address it.
thank you, Andrew and the team, and congratulations. I have some clarity, I needed some clarity on what you do with labs. You said medications can be delivered. What about labs? How do you deal with a patient who requires lab draw?
So, yeah. Another question? Can you take the mic?
Hello, I think this is very incredible. Congratulations to you and the team. When we're sharing, I checked it out and it's really nice. I almost had this consultation with Dr. Ken. But I think it's a great product, and I like that you have acted. About 4 months ago, some people reached out to me with a similar idea that they didn't act, so they're behind. But my question is, recently we've had a case of a fake doctor in the news. I don't know, people in the health profession had it. So when I was going to get some consultation with Ken, I was like, how do we ensure that accreditation that Ken is actually a doctor? Yeah, thank you. One more, one last one.
Thank you very much. My question is about integration of insurance spending, because many people access healthcare through insurance, not be planning to do that.
I think as CEO is going to come aboard, I think I'll answer one of this question about the laboratories. Like we said, we are a one-stop center for everything, marketplace. We are just in the middle to make sure that we connect you to the provider, we connect you to the patient. So for the laboratories, currently laboratories is if a doctor recommends lab tests, we have laboratories on the platform. So once they recommend a blood test or a test in the laboratory gets a notification with the patient's number. But of course, before we get a patient's number, we ask for consent from the patient, and we need to plug the number for the laboratory to reach out to you to get the test. So the laboratory calls the patient, confirms, they copy samples, they have the tests, then they upload the results in our secure portal for the patient. So the patient has results where they are, the sample the patient from where they are, and the results are uploaded in their portal, they have access to the doctor. So that way, they have access to share that data with their doctor. It's upon them to share the data with the doctor for more information. Don't let the question, Madam Lord. Yes, you have the flow of the laboratories, you have the flow of the pharmacy. We just then make sure that everything is set for the same way we go for physical services.
All right, thank you, CTO. Arpa, the Chief Technology Officer. I can take on the rest of the questions. One is on how do you compare service to the platform. Simply go to the platform, www.vitendo.org, create an account. You create an account once and for all. Anytime you need services, you need complex care services, there are various care providers choose. But also, the patients have a range. When you offer quality services, you get in-time feedback. So sometimes you can see which are the excellent providers according to the range. And then the other is on licensing. How do you do Dr. Ken is actually a doctor. So somebody